Very good Thursday evening to everyone. Thank you very much for tuning in to our webinar today with Pantai Hospital Ampang. I'm Tam Ai May, a caring pharmacist, and I will be your host for today. This topic we'll be talking today is about diabetes and kidney disease. Today with our speaker, we are going to find out together what is diabetes and kidney disease about. We are honored to have Dr. Madhuri, a consultant nephrologist from Pantai Hospital Ampang, to share her insights on today's topic. If you have any burning questions or want to understand more about today's topic, don't be shy and do let us know in the comment box below. We will get Dr. Ma to answer them all. And now, please join me to welcome Dr. Madhuri. Hi, doctor.
Hello,
How are
everyone.
you?
Okay, I'm fine here. Now is the raining season, learning mode. I hope everyone enjoy this talk. And I'm going to share with you all with the slide first. You all can see the slide there? Can see the slide? All right.
Yes, I can see it. Yeah.
All right. So let's start our talk today. So this is a diabetes month, and diabetes is on every years of 14th of November. So our topic will be diabetes and kidney disease, basically because I'm a kidney specialist. Okay, so our outline of today's talk will be what is the diabetes, and I will go and tell you what is diabetes kidney disease. That means diabetes bring what outcome to the kidney, and how can you prevent diabetic kidney disease if you've been diagnosed diabetes and keeping it from getting worse. And I'll end with a Q&A section as well. So diabetes mellitus basically is a disease that you pass out sugar in your urine. Is by Greek and Latin words that occur when your body can use the glucose normally. So glucose which is sugar, is exactly the main source of energy for our body cell, so it can function well. But for our body to use this sugar, we need a key, okay, to open up the door for this sugar go into the cell, and the cell itself can and it generate the energy to whole body and to make it function well. So the key itself, which we call insulin, is an enzyme, is taking out from our pancreas. Okay, so the diabetes is a disease that your insulin, which is the key, is either malfunction or is either you lacking of this key, which is insulin. So types of diabetes, basically simple 3 types. Types 1 basically happen in childhood or those who are young people, which is the lacking of insulin or insufficiency. They comprise 5 to 10% of the diabetic populations. Type 2 diabetes usually happens in adult, which is basically just to say our body, it is resistant or without insulin or with or without insulin insufficiency. They happen 90 to 95% of populations are diabetic. And gestational diabetes, that's basically just to say that diabetes diagnosed only while pregnancy and resolved after pregnancy, but it is increased risk later life to develop type 2 diabetes. Okay, so how you diagnose diabetes mellitus, doctor? People are asking that. So basically it's simple. This is by our guidelines of Malaysia. Okay, the latest one with 2018. So which is basically to tell you if your fasting blood sugar more than 7 millimole per liter, or if you take a random, that means you don't fasting, you just drop in any healthcare center, just take the blood, if more than 11.1, you are diagnosed diabetes. Okay, and if the doctor recommend HbA1c, to not be familiar with this marker. This is very important marker and be asking by WHO nowadays as a very important biomarker to diagnose diabetes, which is more than 6.3, simply more than 6.3. But if you go for international guideline, maybe the UK guideline is still use more than 6.5, but we Malaysia stick to 6.3. Yeah, then basically to tell you, you already diagnosed as the diabetic mellitus, and you have to anticipate how to control it and how to overcome the complications. Yeah. Why diabetes so important? Why everyone talking about that? Because we able to notice the trend, especially by reported by the National Health Mobility Survey 2019, which is most updated. And they've noticed that prevalence rate of diabetes in adult in Malaysia, not only Malaysia, actually worldwide, is increasing trend. From 2015 to 2019, which is from 13% up to the 18%, it's just almost increasing trend by drastically. And you can notice that if you see the graphic that I share, which is you can able to appreciate that most of the patient, 50 of patient is actually, they are not realized they actually have diabetes until they go for any screening, they without any symptoms. And most of the age that do not know they have diabetes is in the age group of 40 to 49-year-old. And of course, those who have diabetes, the most population is dropping at the year of 60-year-old and above, because our organ will degenerate. That means our organ will getting older, and of course your pancreas won't function well. The tendency for you to get diabetes, of course, been increasing. Yeah. And number two factor, which is if you notice that our Malaysia up to now still the most overweight population in Southeast Asia. Okay, we are 44.2%. Yeah, and even in the evidently by 2019, again, our National Health Mobility Survey found that 50% of our adult population, so we are actually overweight and obesity, particularly in the women in the age group of 55 to 59-year-old. Basically, they are physically inactive. Yeah, so of course the children also, they also have overweight and obesity, can up to 30%. So watch out of their snack. And the contributor factor, not only by food, we are now over nutritious now instead of under nutrients. Now we are overfeeding ourselves, and physically activity, we are so stuck with the 3G, 4G, even now 5G kinds of the mobile phones, and which is we are causing us physically inactive. Our environment not that friendly, especially during COVID time. A lot of patients come to me say, "Doctor, why the COVID time I seldom physically active because I locked down and locked in my house only, and I actually work from home, limited the activity already." Of course, genetic also contribute to the factor, not only become obese, also the diabetes itself. And of course, if you have disease, stress, or medication can contribute to obesity, you're supposed to screen for diabetes as well. Why obesity important? Why, Dr. Ma, you say so? Because it's evident this from the study again, is the diabetes patient, you can notice that 80% of them, 80%, they are overweight and obese. And how about the obesity group? How many of them will become diabetes? Study proven that it's up to 10%, and even more than that, is actually will become diabetes in the one day. So we able to predict that. Yeah. So it is important that WHO to tell us that it is important to limit your sugar intake 10% or less daily. Even better if you can take 5% by the simple sugar, or we call it refined sugar. For example, if you usual calorie by an adult, either male or female, is the average of 2,000 kilocal per day. And if 10% is simple, equal to a 200 kilocal by unhealthy sugar, or we call it refined sugar, it is included your fruit juice. Yeah, fructose is the just simple to break it down, become fructose and glucose. So it is sucrose and glucose, which is still sugar. Yeah, so it's included your fruit juice. Okay, so if one sugar cube by Malaysia target, we are 5 grams, and it's about 20 kilocal per sugar cube. 200 kilocal should be 40 grams, and it's about 8 sugar cube. Let's see how is our commercial drink. Yeah, so first of all, this is the one that I mentioned. Our commercial drink, you see our fruit juice, our Coca-Cola, or whatever sorts of things. Sorry to mention about the brand name. It's not important. It's just basically tell you our commercial selling beverage is very easily to more than 8 sugar cube for as our recommended daily intake. This means once you take one drink, you already exceed your daily intake or daily quota, and very easily you become obesity or overweight, or very easily predispose ourselves become the metabolic to have any metabolic disorder, included obesity, included diabetes mellitus. Yeah. So once you have a diabetes mellitus, of course, the acute complications that you are thirsty, you're bleeding of vision, you feel tired, hence you go and find a doctor and diagnose you to have the diabetes. Yeah. So how about the chronic complication? If we diagnose you diabetes mellitus, can you just ignore and hopefully it go away? It's not going to happen there, because the complication will come after years. Okay. So basically the complication, what is the complication, doctor? So complication will tell you simply because diabetes is about the sugar clogging in your blood vessel. So easy to remember, is either is a blood vessel disease, is either big vessel or small vessel. Okay, it's just like highway or the normal roadside way. Okay, just a small way, they going to clogging. If you clogging at the big vessel, it will be heart disease. In the brain, it will be stroke. Of course, in the leg, or you will end up your leg become blackish and also rotten, and you need to take out the leg. And if you're clogging in a small vessel, you might feel that your nerve is actually irritable and you feel pain, feel numbness. This is small vessel disease, and you can't see well, you're bleeding of vision, you end up blinding, then it is because small vessel disease. Of course, kidney disease is also one of the complications of the diabetes. Yeah. So have you ever think that if you have excessive sugar in your body, you cannot use up the sugar as energy? Where are they going? So basically, they have to only one exist way only, which is kidney. Your kidney is the one that urinations out everything, the sugar that you overload, and kidney is the only organs that usually it will sacrifice itself and end up to have kidney disease from the diabetes. Yeah. So diabetic kidney disease prevalence has been documented there since 2013-2019. Our kidney disease, in the medical term, we call it nephropathy. It can contribute up to 14.6% for those who have diabetes mellitus, and this is also considered underreporting. It's actually internationally reported up to 40% of the diabetes patients usually have kidney disease. That's why make the kidney disease is so important to screening in all the diabetes patients. Yeah, even the news have been reported. Malaysia now 2000 up to 2018, Malaysia diabetes and transplant registry been reported up to 69% of new patients on dialysis. They all contribute by type 2 diabetes patient. Yeah. So how diabetes can cause kidney damage, except for just now I say high sugar level in the blood can cause kidney vessel to become narrow and clogging. The nerve bladder also are damaged. You may not able to feel your bladder is full, hence your blood flow or urine causing further damage and overflow of your kidney. Okay, and causing the unfriendly environment to kidney. Kidney also need to survive, but because unfriendly environment, hence it become damaged, and if it become fibrosis, we call that, and hardening and become shrunken and unable to function. Of course, third issue is urinary tract infection. All bacteria like sweating and wetting. Okay, why you have a stasis or urine, why you have a sugar so much in your urine, you are very easily to invite the bacteria or even fungal infection in your urine and urinary tract. Once they track up, they go to a kidney, and even worse, they're causing one condition we call it kidney infection. Kidney infection in medical term we call it pyelonephritis. Whether all these things happen very easily, kidney get further damage, acute damage, and also at the end again it turns out to be damaged, fibrosis and hardening and shrunken, then your kidney lost function. Yeah. So in the diabetes kidney disease that we have also 5 stages equal to any non-diabetic kidney disease. Stage 1, stage 2, you feel nothing. You actually detect this stage by just a simple urine test. You can go to any healthcare center just to do the urine test to see got protein or not, to see you got the small protein or not. I call it small protein. Actually, people call it microalbumin, to see that whether small protein microalbumin itself is the earliest you can detect an early stage of a kidney disease. Any treatment for that, of course, there is. So that's why so important for screening. So if you have a diabetic diabetes mellitus, please go to screen your urine instead of screen your blood itself, because while you detect a blood abnormality, usually you're at the stage 3 and 5 already, straight up to 5 already. It will be late already. Because stage 3, you start experience symptoms. You may start experience breathlessness, puffiness of your face, water retention, cause your leg also swelling, everywhere swelling. Your urine might turn into brown color. You might experience some back pain due to a calcium phosphate imbalance, or this kind of thing. Yeah. And stage 4, you even more pronounced symptom. It may be even more acute breathlessness that force you to come and see a doctor. Yeah. And up to stage 5, most likely you are required dialysis already to replace the kidney function. Yeah. So okay, all this is to end up. I need to tell you all the way that you have, how you're going to treat the diabetic kidney disease by yourself and by a doctor. So I have to tell that it's actually simple, divided into 2/3 and 1/3 rules. 2/3 is by patient themselves. That means is you have diabetes mellitus and end up doctor say you have diabetes kidney disease. So 2/3 the responsibility is by you. You can use a non-drug method. I'm saying that diet control. I'm going to share and tell you how to diet control about diabetes kidney disease. And if you're a smoker, please stop smoking. Of course, there's really strong evidence association that we prove that smoking is very bad to the kidney and to all the organs. Stop alcohol as well. Exercise is really evident. This also proved that it's important to reverse some of the diabetes, and even you are lucky you're able to really reverse the kidney disease as well. Stop any possible offending medication. We are included, no matter today you are taking unknown supplement. Some unknown supplement is okay. Unknown supplement, unknown traditional medication that you are don't know where's the source, what it is about, and just to stop the pain itself. It sounds so scary and so it will be causing harm to the kidney. Just do not do it and do not take it. Or you can ask the doctor nearby and to ask the safety of the medication. Yeah, the drug method is usually responsible by doctor and you as well, because you are responsible to understand and compliance. We responsible to control your sugar, control your blood pressure, control your cholesterol. Also, we have to stop your protein leakage in your urine by giving you a medication. And nowadays, especially recent years, so many types of medication come out to just to retard your chronic kidney disease to progress and just to make them to survive again. So I believe your doctor will recommend the good one and also which is suitable for you. Yeah. So again, to prevent to slow the progression of diabetic kidney disease by taking medication, control high blood pressure, manage your blood sugar. Especially you need to measure not only in the hospital setting. You are supposed to check regularly at home. It depends on diet pattern. Manage and change your eating diet and nutrition. Manage to change the pattern and convince yourself to change the pattern. And also, if you can, also involve some dietitian and nutrition advice, which is even better. We call it medical nutrition therapy, which is suit you very well. Losing weight, if you are overweight and Asian overweight, you are taking the weight of BMI still more than 21, but nowadays people saying that you don't take BMI, you take your waist and hip ratio. If a guy, if a more than 1, if female, if more than 0.9, and you know that you measure it and which is exceeding of your ratio, please again check with your doctor what is possible treatment to go to you so that you can reverse or even you can retard the kidney disease or diabetic kidney disease. Both are equally efficient. Okay, getting regular physical activity, getting more active in your life, which is only got benefit, don't have harm. So we go for diet, as I promised just now. I'm saying that I'm going to share the diet pattern and try my best, because it's a very vast topic actually. The early diabetic kidney disease, you can try total diet replacement by taking less than 800 kilocal per day. Of course, this is need the nutrition come in, need the dietitian to advise and need a doctor to monitor, because you have to understand we need to calculate basal metabolic rate for you. For a replacement of your nutrition measure is sufficient for your basic, we call it basal, basic metabolic needed for your daily activity. If because we either use sedentary lifestyle, either you are very active, what kinds of occupational we need to know, so that we have to adjust. Yeah, benefit can up to weight loss up to 15%, and you can aim 6 months reduce by 10%, not too drastically. Yeah, balanced diet is recommended if by our MOH. Okay, yeah, carbohydrate 50%, protein 20% from diet, and fat 30%, which is basically taking all this percentage is actually from divided in your total calorie per day. Remember just now I said the normal people average is 2,000 kilocal per day, and the MOH saying pinggan sehat Malaysia suku separuh, you need to compliance it if you possible, that you take half of it is just by your half pinggan of it is just by your sayur and the buah-buahan, and are by your protein base, either your ikan, ayam, daging, kacang, and another suku is by your carbohydrate. People say kanji base. Okay, and of course we want you take a high fiber diet to make not only you feel easily full, and also you are actually more healthy, in your no matter bowel pattern, or this is a very good prebiotic for your guts as well. So you have nowadays people and other studies say the microbiome in your guts, they need the food. If your microbiome, you reduce inflammation of diabetes, and your diabetes might control well. Okay, so late diabetic kidney disease, how to manage it, doctor? For the diabetes, yeah, we recommended low protein diet, up to if the guideline up to 0.8 gram per kilo per day. You can ask a dietitian to calculate for you. You are very know how to calculate it. There's no problem for it. Then you just calculate 0.8 gram per kilo per day. Okay. If your diabetic control very, very well, and you can try to go for very low protein diet by 0.3 to 0.4 gram per kilo per day. The kilo is by your body weight, but we are advised you take with supplements of keto and low amino acids, so that to prevent you malnutrition. Why very low protein diet? We need we need to a very good diabetic control, because if you take the so limited of protein diet, your choices of diet will be very limited. You might end up not eating anything. If so, usually this one is more recommended for those who are non-diabetic patient instead of diabetic patient. But if you're a diabetic patient and stage 4 or even earlier stage 5, you're able to control well, is still welcome you to try this method with, of course, with the guidance of doctor or dietitian. Yeah. So again, we go back to our staging of our kidney failure. If you see stage 1 or 2, we ask you to diabetic diet, low salt diet, low cholesterol diet. We never ask you to low protein diet first. Okay, I emphasize that. And stage 3 to 4, we start ask you diabetic diet, low salt diet, low cholesterol diet, and low protein diet as well. Some of patient, your doctor might say, hey, hello, this potassium is quite high due to a kidney disease. Some of patient have kidney disease, but doesn't mean that potassium might be high, and their phosphate doesn't mean must be high. So only to a certain patient, they may need low potassium and phosphate diet. Do not hear about other patients. They say, A got kidney disease, B got kidney disease, I have kidney disease, then I listen to A and B, and then I suppose diet same return. Your kidney disease might be different. Not everyone is the same. Okay, the phenotype, that means the type of kidney disease might be different. So please consult a doctor or consult a dietitian, see through your blood investigation result before you decide what type of diet you are suitable. Okay. Okay, number 5, up to the stage 5, if you are already subject to dialysis and do a dialysis, everything you should compliance is diabetic diet, low cholesterol diet, low salt diet, but you have to high protein diet, because you are dialysis, you spend a lot of energy, spend a lot of protein in the dialysis already. If you don't eat protein well, you might end up again protein. We are saying protein wasting syndrome, easy to understand that, yeah? And you're supposed to compliance low potassium diet and low phosphate diet. How much it is? Please again consult your doctor and dietitian, yeah? So, okay, one of the new idea come out, which is PLADO diet. PLADO diet is basically tell you plant-based dominant for those who are vegetarian, Yes, this study show that alkaline diet is better, but it's just recently show. Large data don't have yet, but meta-analysis, this means gathered from a small study, yes, available, show that plant-based diet is good because they are alkaline-based. And you want protein, take the plant-based protein, as I show in the picture. You have tofu, eggs, or whatever source of thing, that tempeh, that you might take it, and they might further improve your slow kidney disease progression, prevent and delay the kidney failure and dialysis, improve your cardiovascular system, which is better. And you might refer to this as well, but watch out your potassium. If you are potassium based, I mean you are potassium tendency to be high, that kind of kidney disease, please consult your doctor or dietitian what kind of preparation suitable you, okay, or what kind of diet suitable you, instead you try yourself, which is if the potassium too high, your heart might be stopped anytime. I'm not to try to scaring you, but it is true, and please with advice. Yeah. Exercise, as I say, exercise, you make yourself active no matter today you are talking about obesity, overweight, diabetes control, all initial benefit, don't have non-benefit unless you are osteoarthritis not suitable for certain kind of exercise. They want understandable. So exercise being recommended in any guideline also say is at least 150 minutes per week, which is basically 13 minutes for 5 days per week. It's quite easily. Moderate intensity, you can just cycling or brisk walk. At least 75 minutes per week if you are vigorous running or jogging or aerobic physical activity. Suggested 5 times per week aerobic exercise, only 2 times per week of resistant exercise. There's been resistant exercise, basically just heavy lifting, which is good for your bone. Yeah. And of course, very important for all my friends, and you all can join the healthcare awareness and service so that you update yourself latest data, latest knowledge about how diabetes going to control, what is the latest in the diabetes, how you're going to eat. You can join, you can go to any pharmacy like Caring Pharmacy for all the blood check and get all the knowledge. You can go for any possible activity, and of course enjoy our talk tonight. I hope you enjoy the talk and understand diabetic kidney disease more. Any question you can just ask. Yeah, that's all. Thank you so much.
Hi, thank you, Doctor, for sharing your knowledge. I think I've learned a lot today. I think our viewers too. And I see a lot of questions flooding in already. So there goes. We start our first question from our viewers. How often must we check our HbA1c test?
HbA1c test basically is the 3 months average of your blood level test. By right, it's been recommended can be 6 months. But if you wanted to know so much, okay, like you screen for the pregnancy baby, by right, your screening is no need to do that frequent, but you wanted to know so much and you want to know average, or you just changing the medication diet pattern if you wanted to know your sugar control, you can take 3 monthly. Yeah.
I see. Okay. So the second question from our audience is, what kind of food that can help to lower blood sugar?
Okay, what kind of food is basically our macronutrient? We have carbohydrate, protein, and we call it fat diet. Okay, fat diet. So we just now been saying that early diabetic kidney disease, we still use the general recommendations that carbohydrate you take 50%, protein 20%, and also fat diet you take 30%, isn't it? So if you are talking about carbohydrate, of course we divide it into the carbohydrate itself, the 50%, what kind of food. We are actually very happy if you can take those low glycemic index food. Complex carbohydrate included those with starch one. Those were with starch, like if you give me you ask me, doctor, white rice and brown rice, which one you choose? I choose brown rice. Of course. Why like that? Because it's more fiber. Not only more fiber, it digests slowly. It makes you feel full easily, so you won't craving for other food. But if you taking the amount is still the same, the sugar in your body was still the same. So it doesn't make any difference. Not even got one kind of diet pattern it come out and been recommended, but also if you take small amount, okay? What kind of diet is emphasized in the sequence diet? Okay, the study group been recommended that if you drink, first of all you drink water first, plain water, like 1 cup is almost 240 ml by internationally scale, okay? Or you want to calculate 250 ml. You take 1 water. After that, you take the protein and also fiber diet first. So you digest first, fat diet after that. After that, only at the end, you take carbohydrate. Carbohydrate diet, which is why, where at the end, you already take so much of thing, you already full. You don't feel that you want to eat. All right. So if you full easily, you don't feel like eating, the most likely whatever you absorb only nutritious thing. So most likely your diabetes will get control. And if you are a first newly diagnosed diabetes, we also recommended you to really cut down your 50% of carbohydrate. 50%, let's say originally you take one bowl of rice, you take half of it you replace fiber diet. That's mean all the veggie, all the kind of veggie. Okay, it also can help. I hope it's answered the question. Is that okay?
Yes. And there's a viewer is curious about if drinking fresh milk or full cream milk or even low-fat milk daily up to 500 ml a day, will that cause diabetes?
Yes, the milk itself, because it is lactose, it's still one, while you divide it, it will become lactose and glucose. Glucose, 50% glucose, you are still taking glucose, sugar is. So by right recommendations is by 1 cup of milk per day. You are taking milk like a water like that, most likely you won't be able to absorb the calcium because the calcium and protein ratio already running. So most likely it won't bring further benefit. And if you take the fresh milk, to be honest, the nutrition itself won't be that complete. And maybe you just take partial of it because it is not as complete as a formula milk, to be honest.
I see. Okay, since we are talking about food, there's a question from Esther. She's asking that during her pregnancy, she's diagnosed with gestational diabetes. And after her pregnancy, she has been having diabetes type 2 since then. And she's now on insulin and medication. And she is very health conscious. And she don't eat much sugary food or drinks. And she actually find that her HbA1c reading is still 8.1%, and she's asking how she can lower it.
Okay, first of all, Esther, I'm not so sure whether physically can be can he active, can he doing exercise as usual people, or he already tried the best. And number two, of course, he said diet itself, maybe he need a dietitian to really look through the diet or come to our doctor. We look through really detailedly, discuss about what is the pattern of diet, whether anything can change from the diet or not, and or any supplement can contribute all this. One more thing is always people forget it. It is they take the fruit juice, and I always think that fruit juice is it is really sweet because you end up the fruit juice, you won't take one portions of fruit and make fruit juice. Usually you take a lot, right? So the fructose itself will really also raise up your blood sugar level, which is I always encourage you, might as well you take the whole fruit itself because it got the fiber itself, which is better, and also you easily feel full after you take the fruit itself. Okay, number three is you need to revise back your medications and to see whether the medication really suit you and how to optimize the medications itself. Yeah, I think which is very important for this three part to be done.
Okay, I think there's quite sufficient to answer Esther's question. Following to the next question, there's a question from our viewer asking why fasting glucose reading is always higher than the bedtime glucose, although no food input after bedtime glucose reading is taken?
Okay, it can happen in few scenarios. First of all, if you eat late dinner, most likely your fasting blood sugar will be high. Number two, if you didn't sleep well, you are not sleeping, your stress hormone high at the morning, which is cortisol high, most likely contribute to your sugar high as well. Third condition is if you're not realized that you actually got, we call it low sugar at midnight. It is one effect, we call that, which is it will recompensate and become your high sugar at the morning because you're already low at night, and your body will try to compensate it by creating some so-called not only stress hormone, also it will convert our sugar, just our body fat or our protein, our muscle itself, to become the high sugar at the morning. So you only able to see high sugar in the morning, but actually you are having the low sugar at midnight. So you have to really realize which type of high sugar you are in these three conditions. If you are late dinner, just quit the late dinner, no more food after 8 o'clock. If you are unable to sleep well, make sure you sleep well, perform the well sleep hygiene. If you are the low sugar at the night, low sugar at the midnight, you have to really see whether you have a very bad nightmare or you are suddenly sweating during at the midnight, that you have to check your sugar at midnight, or you have to perform ask those who are able to observe you while you are sleeping during that time, if you are sweating, unable to talk, confused usually at night, of all these things is the sign to suggest you have a low sugar at night. Then most likely you have to paradoxically to adjust your insulin at night or your medication at night, instead of you have to increase the medication in morning.
Yeah, I do agree. There's a lot of factors that contributes to high sugar, not just only food, but also stress level and other things as well. Following to our next question from our viewers, she's asking that is diabetes type 2 have a higher risk to get gallbladder stone?
Gallbladder stone. Okay, this question you are talking about diabetes itself will cause or not indirectly, the friend will cause. Why the friend will cause? Because who is the friend? Diabetes friend, I always say hypertension, which is high blood pressure, high cholesterol, and they are three good friends. So how come, doctor, high sugar can cause high cholesterol? Because sugar, why you have excessive sugar, where they store? They store in a few places. One important place, our storage in the liver. So people will cause what? Fatty liver. So they got the fatty liver, the liver get inflamed and also hardening and bye-bye. And number two, it will accumulate fat in our body and basically our tummy. So all this oil, or not to say oil, sorry, all this fat will convert into a cholesterol later on, then they become gallstone, no? But they are indirectly caused, but because of high sugar, no? Can
Yes,
I say that?
Yeah, diabetes can have a lot of complications, not only
exactly. Not only diabetes, also cause hypertension, also cause high blood pressure. So they are not the isolated disease, they are actually associated disease. When you have diabetes, you will have a lot of things. So don't get diabetes, try to reverse it. Some of the studies still show diabetes, sometimes you are lucky enough you're able to reverse. But previously concept is if you are pre-diabetes only you can reverse. So I hope that our all audience here, those who are diabetes, able to reverse their diabetes as well. Hopefully.
Okay, because relating to the next question, so there's a question from our viewers asking like, is it possible to reverse the diabetes with exercise and controlling the diet? Like
sorry?
Yes.
Okay.
Is it possible to reverse the diabetes by controlling our diet and exercise?
Oh, this is the question that I'm saying that.
Yes.
That's how I've been answered that.
Yeah.
I did show a lot of again meta-analysis. Meta-analysis means that a lot of small studies show that they evidently show that they're able to reverse if the early diabetes. Okay, previous study never showed that. So I'm not so sure that if a huge data come in, maybe I have more evidence just to convince people really by purely diet, physical activity itself could reverse the diabetes. But usually we will say once you diagnose diabetes, please do not try the method or treatment yourself. I really have a lot of case scenario patients that they really want to try the so-called natural way, the physical activity and the diet itself. At the end up, they end up with very severe complications of diabetes. Okay, please must monitor your blood sugar under doctor monitoring as well, and so that to make sure yourself healthy instead of complication itself. The complication itself usually irreversible, so we do want complication. All right.
Yes, totally agree with that. A lot of people, they would have seek other professional advice first before going to the right person,
which is very dangerous. And yeah, sometimes they are nowadays the diabetes also increasing trend of young age. Basically, I think we are with a lot of I would say commercial kind of good stuff, very tasty stuff, and so causing us to really have a tendency to develop all these young diabetes.
Yes. So one last question before we end our Q&A. What is the best reading for fasting blood glucose level in the morning?
Of course, it's less than 6 if possible. But usually the those who are middle elderly, we are actually recommend less than 7. Okay.
Thank you so much, Doctor, for very insightful sharing today. And indeed, we learned a lot, and I believe our audience also here